Hey, this is Professor Fay with your anatomy lesson of the day. Today we're going to talk about the male reproductive system. So I have a pelvic model with me here. So we have like the right hip and thigh area, and then more medially you can see the penis. This would be the body of the penis, and then this would be the head of the penis. Just lateral to it, you can see this oval-shaped structure, which would be a testis. And what you can actually see is a white covering around the testis called the tunica albuginea. This is connective tissue. Also surrounding the testis is more connective tissue called tunica vaginalis, and then skin, which would be, the skin would be called the scrotum as it surrounds the testis. You can also see this curve-shaped structure here, that's called the epididymis. So sperm is made in the testis, and then it gets stored in the epididymis for a few days, and then it runs through the ductus deferens into the pelvic cavity. You'll be able to see that in a minute. Also running through this structure alongside the ductus deferens, you can see red and blue, so those are some arteries and veins. There would be lymphatics and nerves as well. This whole structure is called the spermatic cord, and all of those things run through it. So then if I tip the model a bit here, you can see the ductus deferens coming in and kind of disappearing behind this structure. This is the urinary bladder. So if I turn this so you can see the mid-sagittal view of the model, you don't really see what happens to the ductus deferens, but what occurs is that it meets up with a seminal vesicle, which is a gland that produces some components of the semen. And so together the sperm from the testis, epididymis, and ductus deferens end up meeting up with the seminal vesicle and a duct there. And they also meet up here with this ejaculatory duct that's in the prostate gland, and all together get passed into the urethra right here in the prostate gland. Because it's located in the prostate gland, this is called the prostatic urethra, just this region. The urethra then passes through this red thing called the urogenital diaphragm. And so here, that little part of the urethra is called the membranous urethra. And then it passes through the penis. And at that point, it's called the spongy urethra or the penile urethra. If we look a little bit closer, you can see that the urethra is surrounded by some polka dotted tissue. That's called corpora spongiosa. And then also just on the kind of anterior most aspect of the penis is the corpora cavernosa, which is a sort of striped in this picture. So the corpora cavernosa fills with blood to cause an erection, but the corpora spongiosa doesn't. And so that allows the urethra to stay open, which is going to be what allows sperm to be able to successfully pass out of the urethra at the external urethral orifice at the tip of the penis. The last thing is you can see that this polka dotted tissue kind of opens up to fill the whole head of the penis. And so the tissue here would be called the glans penis. So that's the male reproductive anatomy.